Okay, locuming. So tell us about your experiences in locuming. Just kind of give us a one-on-one. Like, what have you done up to this date, and what are you doing currently?
Yeah, so when I was a second year resident, I went up to Sault Ste. Marie. So it's a 8 hour drive north of Toronto, or an hour and a half flight. And it was just so nice because the second year for internal medicine is really brutal. Like, you're a senior resident, you're doing 1 in 4 call for a year straight. And by the end of it, I think I was burned out. And I go to the Sioux for this elective, and I see this patient, they emerge, and prescribe them antibiotics, and they're like, oh, like, thank you so much for your care. And I thought they were being sarcastic. And then the next patient I saw, like, her daughter was like, oh, thanks so much, like, we appreciate your help. And I realized, oh no, they're just really thankful. And it's really, really rewarding to have patients say thank you for the care that you deliver. And I really felt like when I was in the Sioux as a resident, I was truly a general internist. I think in downtown Toronto, we have every subspecialist at our beck and call, that I sometimes think it's like a detriment to our clinical learning. So that just really stuck with me. And then I got some really good advice by Dr. Nadine Abdullah, who's at Toronto Western, when I was in my maybe first or second year residency. And she said, like, after you're done your clinical training, spend some time outside of Toronto. And I really took that to heart. So for the past 7 years now, I've been going to the Sioux. I go once a month, sometimes once every couple of months, all depending on their needs and requirements. And then I spent some time at St. Joe's as a locum physician, and then most recently just started locuming at Michael Garron as well. So that's a bit of a snapshot, at least, of how long I've been doing it and the current work I'm doing.
That's amazing. And Mike, as somebody myself who trained in a smaller program for residency, like I was in Kingston, 5 years of diagnostic radiology, and I can tell you because it was a smaller program, there were less trainees ahead of me or between myself and the staff. I found like the experience, the clinical experience was wonderful. So I'm not surprised you're mentioning this from a locuming perspective. But now, like, how did you decide where you wanted to locum? Like, was it just based on your initial experience in Sault Ste. Marie, or was it from talking to people, or did you just want a drastic change from what you were used to in Toronto?
Yeah, it's a combination of the three, I would say. The two main points of contact for locums are Christine and Carrie in the Sioux, and they're such lovely and nice and friendly people that when I was done my elective, they're like, "Oh, you should come back up," and we love having locums. I thought, cool, like, you're so nice and friendly. I'll definitely do this kind of thing. And then a colleague of mine spent some time in the Sioux as well, and he sort of spoke highly about it. It's actually pretty easy to find locums. So there's this great website that's been created called Scout Health. And Scout Health is predominantly for Northern Ontario, but a nice way for individual physicians to try to find, short periods of work, and then a great opportunity for a bit of a one-stop shop, I guess. So, it is quite easy to actually find it. And then, definitely, as I sort of already alluded to, I wanted something different than the downtown experience where, as the attending physician, I mean, the times have changed, but maybe 7 years ago, as the attending physician, I have a senior resident, I have multiple junior residents, I have med students, and I think my own clinical skills can get rusty as a result. So those are definitely some of the key motivating factors.
And so now, as things stand today, like, do you plan to continue locuming for the foreseeable future? Like, what's your true north when it comes to this? Like, why do you want to continue it?
Yeah, my true north is Sault Ste. Marie, I would say, pun intended. But like like right now, at least, I want to keep doing it for sure. Maybe once every couple of months. So I attend at Mount Sinai for 8 to 10 weeks, sometimes 12 to 14, depending on how busy things are per year. And I love that work, but as a clinician scientist, it's hard to do like a 14-day straight block of team medicine. All of my research stuff kind of falls behind. So I definitely plan to keep doing it. My wife, who is a veterinarian and definitely the much
Oh,
more sort of like logical of the two, she was like, well, why don't you just start locuming closer to home? Like, why are you going all the way to Sault Ste. Marie? And as I
yeah,
mentioned, we live in the east end of Toronto. So I was like, oh
yeah.
yeah, that's highly logical. And it's been nice to do that because, there's pros and cons, but one of the cons of the Sault Ste. Marie approach is that, like, I'm gone for a few days. Whereas at Michael Garron, I can sort of, walk 10 to 15 minutes, work really hard for a short period of time, and then come home and sleep in my own bed. But yeah, so I definitely plan on continuing to do it. I think mainly because I just thoroughly enjoy the work.